My name is Danielle Thorpe. This argumentative presentation explains how unvaccinated students in the public school system are a threat to everyone. Unvaccinated students in the public school system pose a threat to everyone because unvaccinated students are harmful to other students in the community. Unvaccinated students have higher chances of obtaining a disease than vaccinated students do. These unvaccinated students are also a part of the population that is the cause of diseases making a comeback in the U.S. While most parents argue that their unvaccinated public school-aged child cannot possibly harm other students that are vaccinated, a student who is too young to receive the virus protection can easily become infected by the unvaccinated student who has the early stages of measles. The symptoms of measles are not always immediate, but the infection is very contagious. This one student who simply walks into school has the potential to infect not only the younger students, but can infect other unvaccinated students. These unvaccinated students are not just a danger to other school students. The students who are now infected with the measles will leave school at the end of the day and infect several people who they come in contact with within their community. This mass infection will cause an outbreak in the community and has the potential of affecting other communities throughout the U.S. Unvaccinated students have higher chances of obtaining a disease than vaccinated students do. No vaccines are 100% effective, but having some protection is better than having none. Jason McDonald, who is a spokesperson for the Centers of Disease Control, states if you are unvaccinated and you come in contact with measles, there's a 90% chance you will get it. This disease will spread around to each unvaccinated student, whereas the students who are vaccinated will not get the disease and cannot spread it, according to CDC. The more students who are vaccinated, the less of a chance a disease has to spread. Vaccines don't just protect the student receiving them. Because of the lack of protection against diseases that would have been otherwise prevented by a vaccine, unvaccinated children are the cause of diseases making a comeback. As more and more parents refuse to vaccinate their public school-aged children, diseases like measles that ceased to exist in the U.S. for 18 years are now returning to the U.S. and affecting others. If all students entering the public school system were unvaccinated, the U.S. would find itself battling an epidemic threat of diseases that were conquered several years once before. Other countries have challenged the effect of vaccines and were left with devastating results. In 1979, immunization rates dropped in Japan and only 10% of school children were being vaccinated. From this, several thousand individuals contracted whooping cough, resulting in 41 deaths. Once vaccines recommenced, the number of individuals with the disease significantly. Director of Kaiser Permanente's Division of Research, Dr. Tracy Liu, and her team discovered that the majority of parents who decline vaccines for their children tend to cluster geographically, meaning students who are unvaccinated generally live close together and attend the same public school system. The clustering of unvaccinated individuals breaks down the protective herd immunity, leaving many individuals in danger of contracting diseases. Many parents claim that children receive too many vaccines all at once, causing immune disorders. Some believe their children are better off waiting until the start of the school year to receive the recommended dose of vaccines. Vaccines are given throughout a child's life from birth through 18. The American Academy of Pediatrics, along with several other entities, conducted scientific research that revealed that there is no evidence that states that multiple immunizations cause health problems. The recommended dose of vaccines is scheduled by the CDC, who closely monitors the safety of vaccines. Students are not better off waiting to receive the recommended schedule of vaccines. Children can come in contact with vaccine-preventable diseases prior to the start of becoming a public school student. By allowing unvaccinated children to enter the public school system, a threat is posed to everyone, and that threat begins with the spread of a disease. In order to eliminate the threat, it is important that all children entering the public school system are vaccinated.